Today, it's my pleasure, my distinct pleasure, to introduce a former and well-respected colleague at the World Bank, none other than Annette Dixon, who, as many of you know, is the partner of our good ex-president Ross. She's a Kiwi through and through, and my earliest recollection of working with her was on gender focal groups in the bank. She represented one region, and I, as a man, represented another region. So that is when I came to realize that this lady is blessed with a lot of common sense and a deep, deep commitment to human development issues. And that goes all the way back to her early years as in New Zealand. She held many, many senior positions. You've seen that from her bio. I will not go into every detail, but her focus in those days was on youth, gender, and basically any human development related issue. She is a committed professional, not only by job, but by conviction. Her 23 years at the World Bank, she's held a lot of senior management positions, not only in operations, where you learn the how-to part of the policy. She worked in Eastern Europe and Central Asia, and then subsequently in South Asia. She's currently the Vice President of Human Development for the entire World Bank Group. This is a big deal, folks. And she oversees what's called groups of practices. That's focal areas, intensive focus, specialists getting involved in the following areas: education, health, nutrition, population, gender, social protection, and jobs. This is a big job, and it reflects the quality of the professional that Annette is, and I am very honored to introduce Annette Dixon.
I was asked to talk today about, to reflect, I think, personally and also in terms of the World Bank, on how the world is changing and how the World Bank has been responding to COVID. And also, you know, personal reflections on it. So I thought I would do that, and it's a huge topic, and I think it's something that we all have, you know, a close interest in, directly and also indirectly. And I wanted to talk a bit about vaccines, because I thought with Rotary's connection to the polio vaccination programs, that this might be of particular interest. At a personal level, Ross and I have managed to stay safe throughout COVID. Our biggest challenge is we haven't been able to get home to New Zealand. We were in New Zealand February 2020, just as COVID was getting really bad. And we cut our trip short to come back, and we weren't able to get to Australia on that trip. So we have 3 grandchildren, 2 in New Zealand and 1 in Australia. The one in Australia we have now not seen for 4 years. And I think all of you who are grandparents will understand how hard that is for us. We were hoping that the quarantine rules would liberalize in February, but that was before Omicron, so that we could get home this year, because I actually retire at the end of this year from the World Bank, and Ross and I will be returning to make our home in New Zealand again at the end of the year. So we're quite keen to get back to start making those plans. So that's really our only hardship, is we haven't been able to get home. Now, I think, you know, all of us who have worked in international development really appreciate how hard it is to help countries to make incremental progress. It's slow. And obviously, some countries have stellar accelerated performance, and there's some huge success stories in the world about poverty reduction, huge numbers of people who have been lifted out of poverty. You know, countries like Bangladesh have done exceptionally well over the last 20 years. China, you know, there's a lot of those success stories. But the humbling thing about working in development is that countries can go backwards so fast. And the pandemic is really threatening to reverse some tremendous development gains that we've seen over recent years. Millions of children have not been in school for the last 2 years in many countries. And even those countries that have managed to have virtual learning, their children have learned almost nothing. So the development gains just in education alone, they've been eroded. It's extremely worrying. And of course, we see other impacts in health, obviously in nutrition, in gender equality, and so on. And so the World Bank, as a counter-cyclical agency, has been really scaling up our assistance rapidly to help countries, and doing it while we ourselves are all working from home. So if you think about it, our work programs have more than doubled in terms of the amount of assistance that we're providing to countries. And we've had to do it while working remotely throughout the whole world. Now, as Mark said, my last job, I was Human Development Vice President. So I was actually leading the initial response for the health systems support to countries at the beginning of the pandemic. And we had to move extremely quickly, and I'm very proud of what we did. In the middle of the pandemic, I moved to a different job, and I'm now responsible for human resources of the bank group itself. And so I've been focused on how we support our staff through the pandemic. So I wanted to talk a bit about the health response, because it has been sort of huge for us. And the response to the pandemic is sort of in two parts: the direct costs of supporting countries to strengthen health systems, and to get access to vaccines and to deliver vaccines, and then the broader support to countries to deal with the social and economic impacts. So our support has really cut across, obviously, firstly, saving lives. And I'll come back to that, because a lot of that has been around getting vaccines to developing countries. Protecting the poorest and the most vulnerable. And there we've been providing financial support to countries to provide income protection and food supplies for most vulnerable households. Helping countries to save jobs and businesses, which has been a huge part of countries' response, and that includes providing financial assistance to countries to be able to help to preserve jobs, and particularly to protect small and medium enterprises to weather the crisis. And then, of course, actually working on resilient recovery and helping countries to plan their exit from the crisis. And one of the things that is very concerning here is that we've seen a rapid increase in debt levels in a number of countries. And so we've been working multilaterally to try and help countries to reach accommodation that will help them to actually weather the crisis and to come out of it. Now, and I have to say, Mark and those others of you who have worked at the bank in the past, these numbers are unprecedented. So we have mounted the largest crisis response ever in the history of the World Bank Group. We've mobilized over $150 billion so far to help countries deal with the pandemic. I think, Mark, you may not remember, but I suspect that when you retired from the bank, we were probably delivering around $20 billion a year in total assistance. So in my lifetime in the bank, this is a huge increase. Now, on the health response, we have moved very, very quickly to support countries. we have already committed $7.5 billion to 67 countries to provide direct support for procurement and delivery of vaccines. And we also have a $4 billion facility to help companies expand production of vaccines in low and middle income countries as well. So to help ramp up the production of vaccines in the developing countries. And that's through our private sector arm, the IFC, that provides assistance to companies investing in developing countries. Now, the assistance for vaccines is done in very close collaboration with the other multilateral efforts. There's an initiative called COVAX, which is essentially helping countries to procure vaccines. And we work through them, so our financing can be used by countries to participate in COVAX and to access vaccines through COVAX. Our financing can be used for direct purchases by countries from vaccine manufacturers for those countries that have been able to secure direct access. And we've also been working to help our countries procure and purchase excess stocks that are becoming available from countries that have essentially built excess reserves and cannot use them, so that these doses can be released before they go past their use-by date. Now, our financing is also heavily focused on vaccine distribution, because as you all are aware, it's a huge job to help countries to strengthen their systems. Now, there is a bit of an irony in this, because developing countries are still doing very large immunization vaccination programs. In some senses, they were better prepared for this pandemic than some advanced economies that had let these systems erode, because they really hadn't been doing mass vaccination programs. So, countries like India, for example, have a lot of expertise and built up capacity for mass vaccination, and so have been able to deliver large numbers of vaccines. But nevertheless, there's still a huge agenda to ensure that there's safe and effective deployment, expanding storage and cold chain systems, data and tracking systems, training health workers, and building trust in immunizations through engaging citizens and communities. Because there is huge amount of vaccine hesitancy, as you all know here, but it's actually, I think, much worse in some developing countries. Now, about half of this financing is going to African countries, which are a priority for us. And we are also partnering with something called AVAT, which is an African vaccine consortia, and our partner there is the African Union, because there's a huge need to scale up in Africa, as I'm sure you're all aware. So I'm extremely proud of the work that we are doing. It is unprecedented, as I said, and I wanted to talk a little bit about our own staff, because I think, as you will appreciate, our staff are living and working in developing countries, and have to be protected through this. And of course, we have focused initially. A lot of our focus was on trying to make sure that our own staff had access to vaccines. And so we have been working in close conjunction with the United Nations to make sure that our staff have been vaccinated. And that's been challenging, because getting access to vaccines for our staff in many countries has been extremely challenging, and only a limited number of vaccines are available locally. So many of our staff have been vaccinated with locally available vaccines, some of the Chinese and Russian vaccines, for example. And over time, we've been able to access some of the other vaccines that give more effective coverage. We also, of course, have had a large number of staff who've become ill, and I'm really sorry to say we've lost 11 staff from COVID since the pandemic started. We've done a lot to try and help strengthen access to systems, health systems for staff who become ill, and including access where needed to hospital care and evacuation. Early on, we had a lot of trouble with evacuation because it was very hard to get landing permits for staff who had to be evacuated. We worked with the United Nations to set up some care centers in countries, in regions, and in Africa where we can get staff to who need care. One of the things that we've done is actually make sure that our staff have access to oxygen concentrators, and we have pre-positioned around the world equipment so that we can actually get equipment to our staff. We have, one of the things that we've done, which has been really important, is to help staff with isolation. A lot of staff live in quite small apartments, and when family members have been ill, it's been hard to isolate. So we've set up primary care level services with accommodation so people can be isolated. So these are staff and family members who are not seriously ill, but they need to be in hospital, but need to be nursed and isolated to prevent contamination with other family members. And then lastly, of course, we've been providing financial and psychological support to staff. Our staff are working incredibly hard as part of this effort to scale up, and the workloads have been horrendous. Many of our staff have had to put plans on hold. We have about 16,000 full-time regular staff, and still to this day, well over 1,000 of them are telecommuting from a country that's not their duty station. So staff have had to move with their families to another location where they can continue to work, but work with, say, kids in school. So when schools have closed, many staff have moved back to their home countries from their duty stations, for example. So we have a constant set of support around all of these arrangements. The last thing is that as our actual offices and how we're running our offices is changing tremendously. We, of course, have closed many offices and kept staff working from home, but we've also been progressively reopening. And then, of course, in East Asia, some of our country offices have fully reopened and business is going on as usual. But we have had a tiered sort of reopening strategy, and we have, so we bring staff back by limiting the concentration of staff, initially 25% back, then 50% back. And we are testing and piloting hybrid work arrangements using the pandemic to really look at whether this is something that will actually be a good fit for longer term for staff who want to have more flexibility. And so we actually have a pilot starting on hybrid work, which I've been leading, and we've been providing resources to managers on how to make that happen. And this is really, we're thinking about what does the future of work look like. And what we want to do is to sort of clearly delineate the time in the office is different from the time at home, and the role of the office is changing. And the time in office really needs to be organized to focus on the coordination, the collaboration, the networking, and so on. And this is very important for integrating new staff. We have continued to recruit throughout the pandemic. and so we have a large number of people who've only joined the organization since the pandemic. And so we, have faced a challenge of making sure that these staff are well included and integrated. And so the way we use our time in the office is changing as a result. So these are perhaps some of the things that are important. I think a couple of positives have come out of it from my point of view for the organization. Firstly, we now have a much more open discussion about mental health and well-being issues. People are more open to discussing the challenges that they face and their kids face. I think our managers are much closer to their staff as a result of the pandemic. We know a lot more about staff's families because we see them in the video conferences. And frankly, our families know a lot more about what we do at work. To the point that they will often pop on the camera and say hello while they're walking past, and have got to know a lot more about our work because we've been working while at home, so everybody is aware of what's going on. So it's incredibly challenging for all of us, as you all know well. But at the same time, I think there's been some tremendous upsides in terms of bringing us closer together as an organization. So maybe, Mark, if I can stop and take some questions, and we can pick up from there.
Thank you very much, Annette. I think a lot of what you talked about, not only in the bank's operational work, has great relevance to what people are sensing here in the US and elsewhere. There are a lot of lessons here. There's always opportunity in adversity, they say. I just wish that those 11 folks in the bank had not passed away, and 850,000 in the United States also, but we're learning. Can I open the floor and let the Zoom coordinator link in questions directly?
I'll be happy to moderate the questions, the Q&A here. We already have a couple in the chat, so we'll take those. I wanted to get things started by asking, earlier in the talk, you talked about some of the responses by governments, both in terms of financial and health stimuli. Can you talk about how it affected different countries and whether there was maybe one response that had better impact further on down, now that we're a few quarters removed from where the stimulus were first introduced?
Thanks very much. Look, this story is still going on. And I think initially, we underestimated some of the risks because initially the pandemic didn't seem to be particularly as bad in some parts of the world. Now, obviously, the region of the world in the first phases of the pandemic that were the hardest hit were the Latin American, Caribbean countries. Latin America's case rates were the highest in the world. And about the last time I looked at the data, the country that had the highest case rates in the world was Uruguay. And that was a surprise to me because so much of attention went to India at the time when Delta hit India, and we saw the huge numbers of people being affected in India. I think because India's got a very large population, the case rates still were not as high as they were in Latin America. And my own personal view is that perhaps Latin America was neglected as a priority in the first phases. Now the countries, I think we have to be humble about countries that have had success, because what looked like success in one phase becomes a disaster in another phase. And I say that in part, if you look at Australia and New Zealand as two examples of island countries that did extremely well in the early phase, but still have today huge vulnerabilities. And this story is not over yet, as we well know. Australia has now got huge increases in case rates. You know, our grandson posts on Instagram the numbers of cases in his state in Australia. So he lives in Queensland, in Brisbane, Queensland. And throughout the last 2 years, there's been a handful of new cases a week, maybe 5. And all of those cases were coming through the border. Today and yesterday, they've got 20,000 new cases each day. So, and they're well vaccinated. And the same is true for New Zealand. New Zealand has been able to basically have almost no community transmission, but they've done it at huge cost. They've kept the border closed, even to people like us. I mean, there's a quarantine system, but you have to go into a government regulated quarantine center. They release maybe 1,000 places a month. And there's a waiting list of multiple thousands of people who can't get in. It's a lottery system. So it's actually easier to win the lottery than it is to get a place in quarantine. So New Zealand has basically kept the country transmission free by isolating itself from the rest of the world. And this is a very open, liberalized export economy. So this is incredibly challenging for an economy that is actually used to being a trading nation with lots of tourists coming and so on. So I'm a little bit humble about saying which countries have done better. I think one thing that this pandemic has really brought home is the strength of health systems. Now we have for many years since when we started having pandemics around SARS and bird flu and swine flu and so on, we have started working with the WHO to help countries assess their pandemic readiness. And this was sort of really countries that had plans and were ready to go if they had a pandemic. And one of the things that really struck me at the beginning of the pandemic is the countries that had been more affected, like China, like a country like Democratic Republic of Congo, which has had Ebola outbreaks. So the countries that have had Ebola outbreaks, they not only had a plan, but they had units they could stand up very quickly. Most advanced economies had a plan, but they didn't have things ready to actually stand up. And so they don't have spare capacity in their systems. And so they've been scrambling, as you can see, to actually build that extra capacity into their systems. So I think one thing that is really going to come from this pandemic is a much greater focus on pandemic readiness. And I think, there were a lot of people who were warning about the risks that the world faces. And now we've seen it playing out in real time. And I think we have a much, much greater awareness of how viruses can travel around the world so quickly in this modern era, and how all countries need to actually have stronger systems.
Annette, thank you for being with us. You've done fantastic work at the World Bank, and thank you for sharing Ross. He is a prize member of our club, and Ross, I know you're hearing this, and we just love you. And just like with Hal Vaughn, we just really honor your participation. But Annette, looking at the global pandemic, what would be 3 best practices? We talked about different countries' response, those that had robust plans yet couldn't implement, others that just kind of had to start and move forward. But what 3 best practices, regardless of the size or economic strength of the country, that you think could be applied universally, or is that just not possible?
I can think of things that countries can do and things that they shouldn't do. And I think, you know, when you see a crisis like an economic crisis like the global financial crisis or this pandemic, for me, the priority is always to protect the population from intergenerational impacts of the crisis. So to try and minimize the impacts in a long-lasting effect. And so for me, you know, number one, of course, is keeping kids in school, you know, maintaining access to basic services like health, keeping kids in school as much as possible to minimize the damage. You know, one of the things I've been very proud to have worked on at the bank is something called the Human Capital Project, where we started to measure countries' development of their population, because their people, because we know health and education outcomes are so important for the productivity and development of countries. And you know, it's fundamental to development, but we've never measured it. And now the World Bank does. And so the things that show up as really important as nutrition outcomes, which, you know, preventing stunting, which affects the child's physical and particularly their brain development. So nutrition for the mother and for the child, incredibly important. The education of women, because we know women who are educated have healthier children and better educated kids, and keeping kids in school and keeping learning outcomes, protecting learning outcomes. So these are the things that are kind of bottom line must do. And trying to minimize the social impacts, you know, trying to keep jobs, access to jobs has been really important. And so finding that balance between minimizing the social contact for the pandemic versus the long-lasting economic impacts have been really important. So, you know, trying to help countries move to reopen safely really depends on vaccination coverage. And so that's been so important to helping to keep the economy going. So it's very much the same impacts as we see here at large for other countries. And of course, countries that have weaker health systems, it's extremely devastating to have this pressure on the health system. So trying to actually reduce the number of people who are sick and the pressure on the health system is incredibly important as well. So those are the things I would give emphasis to. There's a lot. I will get off this call and I'll have a lot more ideas and things that I'm sure there's going to be a lot of books written on this. I actually, by the way, I had an opportunity recently to review a book that'll be published sometime early this year, which is looking at how you get results in service delivery. And it's particularly written around Massachusetts State. And they had a chapter in the book on how they've been dealing with COVID. And one of the things they did in Massachusetts is they set up contact tracing really early on, and really tried to work to contain outbreaks. So that's something that, you know, having these systems in place. And this is where a country like DRC that's been dealing with multiple Ebola outbreaks have these systems for dealing with outbreaks of communicable diseases like this. And so helping advanced countries to actually get those systems up and running quickly has been quite important.
Thank you very much. And it also shows that we need to be learning from the world and not just think we're the repository of all knowledge here in the United States or the Western world. So thank you, Annette, for being here, and best wishes as you move back to New Zealand. Very beautiful country, and I've enjoyed visiting there.
Yeah, one thing that I think there will be a lot written on, I just want to add one more thing. I think countries that have more unified health systems have probably been able to cope better. Systems that are very disaggregated and fragmented have really struggled. And the United States has a particular challenge because public health is managed from a completely different system from personal health services. Whereas in an NHS type system, like the UK has and some other countries, public health and personal health systems delivery is run out of the same system. So the two systems work much more closely together. So it's much easier. For example, the UK has a very elaborate testing strategy, which is not, the testing strategy here is still nascent. You know, the UK has been delivering vast numbers of tests, home antigen tests, to population so that people can test. So their testing has been a big part of reopening the economy. And they're able to do it because they have a vast centralized system. So they're able to get out the huge numbers of tests out through their systems because everybody's enrolled in a primary care practice. And so they're able to deliver some of these things. So I do think one thing that the US will need to think about is how public health is managed separately from the rest of the health system.
I had kind of a larger question in your HR capacity. I was wondering, is it a challenge to manage a workforce that comes from so many different cultures from all areas of the world?
It sure is. It's not easy.
Okay.
It's not easy, and I think one comment I would make, and this is more a sort of a belief, but I don't know there's much evidence behind it. But you know, we recruit from all over the world, and we've become more diverse as time has gone on, and it makes for an incredibly rich environment. I mean, one of the things that, you know, Ross and I came thinking we were coming for 2 years, and I would work for a couple of years at the World Bank, and we'd go back home. And I got completely sucked in. And a big part of that reason is because I just really love working in the diversity with people who are committed to do good work in the world, super smart, well-trained, and from all over the world. And so, you know, I really do see it as a strength, but it's not easy. But one thing that is interesting about the World Bank and the IMF is that because of our governance structure, there's always been a gentleman's agreement that the head of the IMF is a European, and the head of is nominated by Europe, and the head of the World Bank has always been nominated by the United States. And to this day, we've only had US citizens who have been presidents of the World Bank. And people say that has actually affected the sort of dominant cultures of the two organizations. So people come from, you know, really diverse backgrounds and bring their own culture and language to the organization. But the organization itself has a culture, a way of working. And so a lot of what is challenging for staff is actually fitting into the US, it's not the US culture because it's a kind of hybrid, but it's more like the US than the IMF is. In the sense that this is the organization is an organization that fosters a lot of robust debate, very talkative. People talk a lot, talk well. The IMF is a bit more hierarchical and structured, whereas the the World Bank is a bit more sort of open, and people are probably a bit more challenging of their bosses. So it is difficult. Where it becomes really challenging is when we get to our core values around behaviors. And here we have really worked very hard to say these are the World Bank Group's core values. one of the sad things I have to do in my job is to decide on discipline or sanctions of staff who have contravened our staff rules. And sometimes people will tell me that they, they did something because it's quite normal in their, in their culture to do stuff. Sexual harassment, it's okay to ask, one of your staff out in some countries. It's not okay in the World Bank. I was just talking to somebody who was giving contracts to a family relative. And this person said to me, look, in the context where I am, in the country where I am, this is how I know I'm going to get a good service for the bank. I was doing it for the bank, but it's not okay under our staff rules. So these are the areas where it becomes quite challenging.
Well, thank you very much. That's insightful.
Annette, I want to thank you very much for your remarks today. A number of us, myself included, have had careers in international development. And it's very impressive to hear the response that the World Bank in particular has had under your leadership to the pandemic. And I'm sure you made a huge difference. We have a tradition as a club of planting a tree in the honor of each of our speakers. And we will do so for you. And if we had been able to have an in-person meeting, I would be handing you a tree certificate with our pledge to do so. We're hoping to resume tree plantings in the spring. We'll invite you to attend. We will be able to actually tell you the location of your tree. So thank you again for speaking. We really enjoyed your remarks today. And I hope to see you and Ross before you move on and return to New Zealand. And Ross has always been a very dear member of the club too, for me. So with that, we will conclude the meeting. I would